Hello everyone, welcome back to my channel. I am Prashant, a 5th year medical student at Smolensk State Medical University, Russia. Nowadays my gynecology cycle is going on in the Krasny Krast hospital. It is a very huge hospital. There are many buildings and all are connected with each other. My class was in the gynec building, that is building number 4. On the first day I don't know the entrance. Instead of main entrance, I enter from the teacher's entrance. The assistant yelled on me, but who cares? She was yelling in Russian that I don't understand. So yeah, my teacher is Sergey sir. He is a very kind and knowledgeable person. And in Russia, the male teachers are more good than the female teachers. The cycle was nearly 2 weeks, in which we also watched the surgeries. It was a laparoscopic. During the cycle, the sir has a conference in the Moscow, so he went over there. And in that period, our class was taken by the Elena ma'am. She was also a very great teacher. The exam of the gynae is in the next semester. In this cycle, every day any one of us will make a presentation on the topic of that day, then present it. My topic was endometrial hyperplasia. Watch the video till end and enjoy the video. Thank you.
प्रशांत दोगले
पाणीपुरी गोदावरी खाली का तू गोदावरीची कसली बेस्ट राहते असं हे राहतं त्याच्यात ते केस पडू नये म्हणून
नाही ना तू कॅप देशील रे मला वाटलं
आलं
ए भाई हा का व्हिडिओ घेतो ए भाई ते काढून टाक ना
Kari.
Left vessels. Так. Muscles.
यश ऐक ना
Self diagnosis.
हे दिसते ना तिथं डॉपलर कर ना ते
Biopsy, endometrial biopsy. Yes, endometrial biopsy. But do you make any other tests?
Ultrasound.
Yes, ultrasonographical study. What else?
Physical examination.
Make physical examination and gynecological examination too.
Rule out cancer, fibroids, and polyps.
Ultrasonographical study. What else?
Blood profiling for coagulation disorders.
Yes, calculation test of blood. What else?
Thyroid function tests.
Yes, what else?
आता कधी नाही तर पहिलं
Well, as reason of abnormal uterine bleeding. Do we need beta HCG test?
No.
We need.
Yes.
If your patient has periods, she may be pregnant.
Yes.
Yes. If patient has Можешь встать. Мы стендап.
And wipe it off with the dry one. The old blood, wipe it off.
Perimenopausal and postmenopausal because treatment and investigation will change with the age. In case of a reproductive and perimenopausal woman, we will first do the urine pregnancy test because pregnancy is one of the most common clinical features of atypical uterine. And then if UPT is negative, then we will go for transvaginal sonography. And in case of postmenopausal, we will directly go to the transvaginal sonography. In transvaginal sonography, why we are doing this is to first thing is to rule out the other pathologies, because atypical uterine bleeding is common in fibroids, polyps, and at menopausal age. we will in all females we will go for the endometrial sampling irrespective of the ultrasound finding, because in case of a premenopausal woman, there is most probably the imbalance between the estrogen and progesterone, and there is misleading diagnosis maybe. So we will go for endometrial sampling. And in case of a postmenopausal, when the endometrial thickness is more than 4 mm, we will go for the endometrial sampling. So the risk factors, first is obesity. Obesity is a risk factor because adipose cell convert the androstenedione to the estrogen that lead to the excess estrogen. In PCOS, as we know, there is an anovulation. Anovulation leads to the no corpus luteum formation.
One remark. So obesity is not good, right?
Yes.
Definitely. But anorexia is no good either, because in females, especially in females of late reproductive age, when the function of the ovary fades away, the fat tissue is the important source of extragenital estrogen source, right? So, and the normal percentage of the fat tissue in the body of the female, what do you think is? What is
25-30%.
20%. 30 is a bit too much. No? You like 30?
In PCOS, fractional curettage. So dilation and curettage, it is a blind process in which.
By the way, just to explain, fractional curettage. What is this?
Yeah, I will explain.
Okay.
In case of a dilatation and curettage, there is a blind process in which we will scrap the whole uterus and put it in one bottle.
Why it's called fractional?
Because we will divide the uterus, we will take the scrap from the fundus and put it in a bottle and name as fundus. Then we'll take from right side wall, then left side, and we will separate. It will be better.
Everything is done in a blind way.
Yes. We will fraction the divide the uterus and send it for the. We can see in image there is a sampling of.
But anyhow, the mixture of material is still possible. It's impossible to totally differentiate which is which. So the first will contaminate the second definitely with some cells.
Yeah, there is hysteroscopy and the curate and endometrial sampling. Then management for the endometrial hyperplasia with atypical cells. Chances of progression to the cancer is up to 40%. And so whenever the endometrial biopsy shows the endometrial hyperplasia with atypical cells, then next step is the dilation and curettage plus hysteroscopy. Best management is total abdominal hysterectomy, remove the uterus and the cervix. The management according to age. So in case of a reproductive age woman or there is no family complete, then the goal is to preserve the fertility and prevent the cancer progression. The steps include exclude the carcinoma, then high dose progesterone therapy, continuous type. Every day we will give her the high dose progesterone, that is 40 to 160 MPa per day, or mesosterol up to 160 to 320 mg per day. Then we'll do the follow-ups.
What is the total duration of it? How long?
Until the endometrium is come to the normal, then we will suggest her to go, get pregnant as soon as possible.
How to know the endometrium became normal?
Transvaginal sonography.
It will just indicate us the endometrial thickness, right? So still at least half a year is necessary to stabilize the condition, right? Then the vital biopsy can be taken, and if everything is normal, then we can allow pregnancy, right? So if you choose
physiologically luteinized granulosa cell, clinical feature
cell, transitional cell, or undifferentiated. In germ cell, there are
Progressions, viral oncogenes E6 and E7. Inactivate deficiency, recognizing the signs and finding relief. Estrogen deficiency affects millions of women, yet many suffer in silence without understanding their symptoms. With these comprehensive guides, explore the science, impacts, and effective management strategies to help you regulate your well-being and quality of life. Common symptoms of sex: intimate health challenges. Estrogen maintains vaginal tissue health by promoting lubrication and elasticity. Without estrogen, vaginal walls become thinner, drier, and more fragile. Reduce natural lubrication during arousal, painful intercourse, increased risk of vaginal infections, burning.